Hey everybody, this is Supervisor James Gore. I'm talking to you from my home here in Sonoma County. Like many of you, I am at home. The coronavirus has caused not only the county of Sonoma, but the state of California to issue stay-at-home orders. And sometimes these are referred to as shelter-in-place, sometimes they are stay-at-home orders, and other times they've been called extreme social distancing orders. These have been promulgated by, in some cases, like for instance us, by our county health officer. But now Governor Newsom last night in his press conference issued one for the entire state of California. There was already 21 million people under these orders by local jurisdictions. So that includes Sonoma County, Marin County, San Mateo, Santa Clara, San Francisco, LA County. But the governor's action took that from 21 million people to 39 million people. What they're trying to do is basically not let the coronavirus get ahead of us. So the coronavirus is called the novel coronavirus. The novel part of that means that it's a new virus. It means that we do not have any immunity either as individuals or any herd immunity as in our community to be a defense. So this does mean that there are going to be a lot of cases in our community and throughout our state and our nation. We are looking at the numbers and trying to get some good modeling out there. It's difficult because the numbers are all over the place. But if you look at what's going on in other areas around the world, with China, with Italy and other places, South Korea, Iran, hotspots have you, is that it's not abnormal to see, even on a conservative side, is 20% of the population over the course of the next 6 months to a year getting coronavirus, being infected by coronavirus. So if that was us in Sonoma County, if it was 20%, that'd be 100,000 people. Maybe it won't be that high. Maybe it'll be 10,000. Maybe it'll be 20. But the thing that we have to realize is that, first of all, is that 80% of the people who are infected by coronavirus are going to be asymptomatic. They are not going to show any symptoms. 15% of the people are going to be symptomatic, but not to a level that requires intensive care or ICU treatment. 5% of the people are going to have needs above and beyond normal care and are going to have to be looking at an ICU situation. This is all information that's coming out of our chief health officer for the county. Her name is Dr. Sundari Mase. Dr. Mase is an expert in epidemiology and the spread of diseases. And basically, she is the one that we are listening to. We're not playing politics with this issue, and I never will. I don't on normal issues, but especially on something like this, I am taking the advice of my county's doctor, Dr. Mase, just as I would for my own family and do for my own family with my own doctor. I encourage you all to do the same. If you are in a situation where you are concerned about having symptoms, and you go to your primary caregiver and they are not administering a test for any reason and you're questioning if you're getting the right level of care, I encourage you to go back to that primary service provider and express your concern or your interest. On the other side, it's a free country and you always have a right to get a second opinion. You can always go to a different doctor, a different clinic, an urgent care room, an emergency room, but the key here is not to cause overflow into those areas. It's to make sure that the standard of care is right. The county runs public health, but that is public health guidance and oversight. We do not administer direct services to individuals. So once again, your doctor and your clinic and your hospital, wherever that is your primary point of contact. So we've gone over the numbers. One of the things that people have been asking me is, does the state order change the local order, the Sonoma County's local order? We have already had our staff in Sonoma County look at the crosswalk, the order that's out of the state and ours, and they are consistent. So what you're hearing from us locally is the way you should move about your business. I want to clarify the difference between a stay-at-home order and a quarantine. We are not in a situation where we have called for a quarantine. Our doctor has not done that. If this was Ebola or some other kind of disease, you would find things like these issues that people are talking about, like martial law, home confinement, other things like that. That is not where we are. Where we are is in a place where this is trying to minimize social contact between people. And the big point there is that as we know, there's going to be a lot of people in our community affected. It's even at this point, we don't know if we're going to be able to decrease the number of people who are infected by coronavirus, but we do know that if we take these actions now, we can flatten the curve so that we don't have all of the cases coming in the first 2 months when our healthcare can't handle it. We're going to try and even that out over 6 months to a year so that our healthcare system and providers can do a good job. The governor's office has advised us as counties to try and increase our capacity of our hospital beds by 25–27%. We are working on plans to not only increase it by that much, but even more here in Sonoma County. We currently have 900 beds available in hospital settings, and you can imagine that we're trying to increase another 300 to 500 of those for any kinds of needs that happen. We are in a situation where we're trying to take prevention and precaution to its maximum, but at the same time, as you've seen, is allow the economy to continue to go in a way that conforms with social distancing. So many people have seen that there's a litany of essential services and products and other activities that are allowed under the ordinance. This is not to pick winners and losers. This is to let folks know that if you are operating your business and it's a necessary function of what's going on in our community, or if your business is hugely dependent upon perishability, food and ag crops and other things like that, the goal is not to kill the economy. I want Sonoma County to continue, all of us, a thriving economy. So we've been able to clarify a lot of things on which businesses should continue to remain open, but all of them have to adhere to best management practices that are being put out not just by our health officer, but by the Center for Disease Control and others. So, you know, for instance, shipping and mailing is open, grocery stores, pharmacies, pretty much the entire food and ag sector because of perishability of crop and other things. But once again, all the assumption and the understanding is that all of those companies need to practice social distancing in their operations, even if they're going to do that work. So once again, I want to thank you all very much. I'm going to hit a couple more things real quickly. One was that people are asking me about the National Guard. They've heard rumors about the National Guard. I want to clarify that the National Guard has not in any way been engaged to increase enforcement over these stay-at-home orders. The National Guard has been engaged by the governor's office and by us as counties to help with necessary business. So the first and foremost is food banks. You can imagine food banks are mostly staffed by volunteers, and volunteers are told to stay at home. So the food banking system throughout California is trying to get, and in individual areas, is trying to get assistance for people to pack boxes and do necessary work from the National Guard. If you see National Guard Humvees or vehicles in your community, it's because of that. It's not because of martial law. I want to be very clear that we've had good collaboration with the governor's office. The numbers are all over the place. The governor's letter to the president said that we could have as much as 53% of Californians infected by the coronavirus in the next 8 weeks or so. Our estimates are lower than that, as I told you earlier in this video, but it's going to take us 2 to 3 weeks to get some good modeling numbers, and our Dr. Mace, our county health officer, is tracking that. Currently, the stay-at-home, the shelter-in-place order in Sonoma County is good through April 7th. At that time, or close to that time, Dr. Mace will have to make the determination with our Emergency Ops Center and others if it's going to extend for more time. That decision would be based on data and modeling. I've gotten a couple calls from people who are like, why are you doing this? Why are you doing that? And I say, because I'm taking the advice of my doctor, a licensed professional with huge experience and knows epidemiology. So once again, Sonoma Strong. I'm here on homestay like many of you, but I'm also getting out and taking my kids around. I'm practicing what I preach, following doctor's orders to the best of my ability, and I hope you all do the same. California strong, Sonoma strong. Much love to everybody out there. Thank you very much.